These striking before and after images illustrate the profound consequences of lobotomy, a highly controversial procedure promoted by the infamous physician Walter Freeman. Once regarded as a revolutionary treatment for mental illnesses, lobotomy involved severing sections of the prefrontal cortex while patients were awake. Initially hailed as a solution, this procedure ultimately left countless individuals with irreversible damage. Walter Freeman, who had no formal surgical training, conducted more than 3,400 lobotomies from the 1930s to the 1960s. He was known for his unconventional methods and claimed he could complete the procedure in as little as 10 minutes. Freeman utilized photographs of his patients taken before and after surgery as promotional materials to endorse this now-discredited approach. While some post-operative images may suggest enhanced moods, they starkly reveal the enduring physical and psychological injuries suffered by patients. In a particularly unsettling case, a woman diagnosed with schizophrenia was described as having been reduced to a veritable household pet after her lobotomy, highlighting the dehumanizing effects of the procedure. Despite widespread recognition of the debilitating consequences of lobotomy, including a staggering 14% mortality rate, the practice persisted until the 1970s. The procedure involved inserting a sharp instrument through the eye socket into the skull to disrupt connections between the prefrontal cortex and other brain regions. Initially introduced as a mainstream treatment for psychiatric disorders in some countries, lobotomy was controversial from its inception. Critics argued that it often failed to address the complexities of severe mental illnesses, rendering it an inappropriate and harmful intervention. The procedure was first developed by Portuguese neurologist Antonio Egas Moniz, who received the 1949 Nobel Prize in Physiology or Medicine for his work on leucotomy, a precursor to lobotomy. However, this recognition has faced significant criticism over time. The use of lobotomy surged dramatically from the early 1940s to the 1950s. By 1951, nearly 20,000 procedures had been performed in the United States alone, with even higher rates in the 1950s. UK. The procedure disproportionately affected women. A study from 1951 indicated that nearly 60% of lobotomy patients in the US were female, while records from Ontario between 1948 and 1951 indicated that nearly 60% of lobotomy patients in Ontario were female. 1952 showed that 74% of lobotomy patients were women. By the late 1950s, its use began to decline in both the Soviet Union and Europe as evidence of its harmful effects accumulated. While some patients exhibited minimal changes post-surgery, others suffered severe physical disabilities or cognitive impairments, with some reduced to a persistent vegetative state.